Hi everyone, I'm Dr. Ken Rousslang, and I've gone through the most reputable medical journals to find the most up-to-date scientific evidence on how to get you into the best shape of your life. Thanks for checking out my video on shoulder pain. As a medical doctor, I see a lot of people complaining of pain in the shoulder, especially athletes and older people. So today I'd like to go through those common types of shoulder pain and then show you workouts that are going to help prevent and reverse that shoulder pain. The most common type of shoulder pain I probably see, especially among athletes, is something called a rotator cuff tear. Specifically, the muscle that's usually involved is something called supraspinatus, and that's a small rotator cuff muscle that runs here along the back of the shoulder. And if you have a strain or a tear of your rotator cuff muscles, you're usually going to have pain anywhere within this black outlined region. The test that's associated with pain for that is the empty beer can test. So if doing this motion causes you pain, you likely have a rotator cuff strain or tear. Next, another very common type of shoulder pain I see is something called a labral tear. The labrum is a cartilage ring that goes around the scapula that connects the humerus, which is the major bone in the upper arm, to the scapula, which is the triangle-shaped bone in the back of your shoulder. So if you have a labral tear, you're going to have shoulder instability, as well as pain, catching, clicking, popping, noises that happen when you do overhead movements like this. And usually that pain is associated in this area that's outlined in blue, and it's especially sharp deep within the joint, usually at the front or back of the shoulder. Lastly, if you have something called frozen shoulder, otherwise known as adhesive capsulitis, you can have pain anywhere in the shoulder, and that's usually pretty easy to detect because any movement of the shoulder is going to cause pain. And that usually occurs in people that are aged 40 or older, but if you're an athlete that plays something that involves spiking a volleyball, throwing a baseball, serving a tennis ball, you can get it at a much younger age. Now that I've explained the different causes of shoulder pain, I'm going to go ahead and start my workout. And to do this, I'd like to start by warming up the shoulders, some simple shoulder circles. Nice and small at first, a bit bigger. Do this for about 30 seconds. Feel the joint warming up. A few more. And I have to do some shoulder reaches, up, back. Good. Do some huggers. All right, so the great thing about the shoulder is one of the best moves that are going to prevent injury and arthritis in the shoulder is also going to keep your total body in shape, and that is my personal favorite workout, the basic push-up. So to do that, so you get in my plank position, hands about shoulder width apart, feet pretty much together, and I'm going to do push-ups for about 60 seconds. All right, everyone? 5, 4, 3, 2. Notice I like to go for time more than for reps, because for one, what really matters is getting good clean reps, not the total number. Don't get hyped up on the number of reps. But for two, what really matters to stimulate muscle growth and muscle strength, to protect that joint capsule, is the time under tension. So 60 seconds of tension is a lot better than doing 20 reps that are not good form. All right. – 60 seconds is also basically long enough for me to do as many push-ups as I can. Notice my elbows go straight back, about 45 degrees. Don't want them flaring out like this. It's gonna put too much pressure on the shoulder. Also, as with any plank style workout, I keep my belly button tucked into my spine. What you don't want to do is stick your butt up like this. You push up like this. That also puts a lot more strain on the shoulders. Let's keep going, last couple. Good job, everyone. The muscle most implicated in shoulder injury is the supraspinatus, and it's one of the 4 rotator cuff muscles. So to work that muscle, I'm gonna do shoulder raises. So I'm gonna go like this, and then I'm gonna bring it forward, and then back. I'm gonna do this for about 60 seconds. 1, 2, 3. I have about 5 pounds here. You don't need a lot of weight. My focus is always on lower weights, higher reps to prevent injury. If you really want to make this move count, do it on one leg. And about halfway, I'll switch legs. Very good, keep it up. This move definitely burns. Supraspinatus is really involved in this part right here. The bottom half of the motion. Alright, just a few more seconds. 5, 4, 3, 2, 1. Very good, guys. Now that we gave our shoulders a good workout there, I'm going to take a break on the deltoids more, and I'm going to work on side planks with external rotations. Let me demonstrate for you. Get into a side plank like so. Lock the feet together. I'm just going to do rotations like this. 60 seconds per side. Ready? Go. Trying to keep my left elbow tucked into my side. If you've ever injured your shoulder, your doctor or physical trainer has probably recommended these external rotations just standing up. But in order to maximize our time together, and because this is high intensity interval training, I've incorporated a side plank just for fun. It's also gonna maximize the leverage that I'm pulling against with my shoulder. Okay? Almost done with this side. Hang in there, guys. More seconds. 5, 4, 3, 2, 1. Bring it down. All right, good job. Cool, I know that was hard, but we got one more side to do. Same thing here. 5, 4, 3, 2. So I feel my obliques burning up right now. Elbow tucked in. Can't go a full minute, that's fine. Feeling it now. A few more seconds. 5, 4, 3, 2, 1. Bring it down. Ooh, that was hard. That is something I do regularly to keep these preventing injury. The next move, I'm going to go back to working the pecs in addition to the shoulder. Really keep our shoulder in tip-top shape. And to do that, I'm going to do push-ups with the side arm balance. So let me demonstrate for you at home. I'm going to do 2 push-ups and then hold a side arm balance. I'm going to switch sides. 5, 4, 3, 2. I'm going to do this for about 60 seconds as well. If you fall over, if you tumble, that's fine. Putting all your body weight onto one shoulder like this is really going to help build the strength in the shoulder joint. More of a rolling onto your shoulder like that makes it balanced. Really builds those stabilizing muscles. A bench press is great for building muscle mass. But this is great for building muscle strength, muscle density, and working those stabilizing muscles that you're not going to be able to hit if you're lying down on a bench. A couple more seconds. Last one. I'm going to do a bonus for you at home. 2 more. Very good, guys. All right, everyone, and for that last move, if it was a little bit too difficult, you can also modify it by just doing a plank to a side plank hold. I'll demonstrate one for you real quick. Plank, instead of doing a push-up, I'm gonna hold it here, down. Hold it here, down. And that's also gonna give you a good core workout and engage your core very well. We did external rotations early in the workout, so you might guess that next we have to do some internal rotations to balance it out. Now to do that and to incorporate high intensity interval training, I'm going to do an internal rotation like this, pressing against this tree while also incorporating a yoga pose, all right? I'm going to go for 60 seconds per side. 5, 4, 3, 2, go. Now it's important in the yoga pose to keep the knees over the toes, not over the toes this way, but in line with the toes. Keep your chest up and out. And I'm really pressing in with my left shoulder right now, getting a lot of tension. In addition to working those internal rotators, muscles like subscapularis, you probably never heard of, or if you have, it's maybe because you injured it, but working those small muscles is really important to preventing injury. Hang in there, guys. I'm also getting a good stretch here. My shoulder, pectoralis major, and my legs are burning. 5, 4, 3, 2, 1, and bring it down. Same thing on the other side here. Right arm now. Holding yoga pose. 5, 4, 3, 2. This is a very popular move with physical therapists as well. Critical in rehab, but more than just rehab, we can use this to prevent and even reverse injury and arthritis. You don't want to have to get to the point where you're told to do rehab for your shoulder. It's a very delicate structure. The longer you can keep it in shape, the better. Notice I really stick my butt out, just like I'm sitting back in a real chair. And that's good form for any squat, any yoga pose, anything like that. And really feel this in my quads. 3, 2, 1, and bring it down. Good job, everyone. The next move for our shoulder injury prevention workout routine is going to be more shoulder raises, now a little bit modified. I'm going to bend over at the waist, not the back. I'm going to go out to the side, and then I'm going to go forward. And then I'm going to stand up, do the same thing. To the side, forward. I'm going to do this for about 60 seconds, all right? Let's get started. 5, 4, 3, 2. You can ask anyone that knows me. I can't remember the last time I picked up a dumbbell that weighed more than 10 pounds. And this is no exception. You don't need big heavy weights to get in great shape. more seconds. 2, 3, 4. Good job, everyone. Now that we've done that, I'm going to go back to one of my favorite moves, and that is the Spider-Man push-up, okay? Sounds a little bit complicated, so I'm going to demonstrate one for you at home first. Get into my regular plank position, and instead of just going straight down and straight up, I'm going to incorporate my obliques, my hip flexors as well. I'm going to go down, touch my knee to my elbow, come back up. I'm going to do these for 60 seconds. 5, 4, 3, 2. Just like my favorite move, the regular push-up. But now, added obliques, some hip flexors. On top of that, this is one of the very best moves for your labrum, which is that cartilage ring that keeps your arm into the socket. If you've ever dislocated your shoulder or had any clicking or popping in the shoulder, a lot of times that means your labrum is injured. And this is one of the best moves. Keep that strong. The other best move for that are those internal rotations I did against the tree. You're in really good shape. Bring out to the side like this. A few bonus seconds here for you guys. These are tough. You breathe as you go up. Inhale, exhale. Good job, everyone. This next move is a classic, but it's a very good one, and that is shoulder circles, all right? So I'm gonna do shoulder circles like this for about 60 seconds. I'm gonna switch directions every 15 to 20 seconds. All right, here we go. This move is really good for supraspinatus, which is the most commonly injured muscle of the shoulder, which I talked about in the beginning. You don't need to go real high like this, guys. Bring it right to about the level of your ears and down is good. Switch. It's also working my deltoids. Just going to give us that aesthetic look to our shoulders. I have 5s here. And I can't really go any heavier than that for 60 seconds. If you're in tip-top shape, go ahead, go up to 6s, even 10s if you can. 3, 2, 1. Good job, everyone. Good job working out our shoulders. Lastly, it's very important to cool down the shoulders and stretch them out so they don't become tight. I'm going to do that with some simple shoulder stretches. First, I'm going to hold this for about 10 seconds. Really feel this stretch, especially in the back of the shoulders. Okay, switching sides. Feel this more in the front of the shoulders. And the front of the shoulders are really more important for injury prevention. If you ever dislocated a shoulder or know anyone who has, you'll know that the shoulder dislocates forward. So stretching and building these muscles in the front will help protect you from that type of injury. One more in the front. One more in the back. All right, good job, everyone. Thanks for watching. If you enjoyed the video, please click like and subscribe. See you guys next time.